You're highly welcome back again to my channel once again. So let's talk on important topic, the good vitamins for kidney and one to avoid and stay healthy. So before dive in, don't forget to subscribe, like and shared, and you even dropped your question in comment section. So, when looking to keep your kidneys healthy, vitamins are a great way to supplement your diet and maintain your kidney function. Kidney disease can lead to many different complications. Incorporating vitamins in your diet is a great way to mitigate kidney problems and maintain your different complications. Incorporating vitamins in your diet is a great way to mitigate kidney problems and maintain your overall health. Taking vitamins may be just the thing you need to improve your kidney health and get back to a lifestyle you love. Asterisk, always speak with your healthcare provider before taking any new vitamins. When it comes to taking supplements for kidney health, not all vitamins are equal. Vitamins you should avoid taking may include vitamins with minerals that may cause kidney stones or vitamins that contain potassium. For example, if you have kidney disease, high doses of vitamin C may do more harm than good. This is because vitamin C may cause oxalate buildup, a compound that may lead to kidney stones. Vitamins for kidney health. Including these kidney health supplements into your daily diet may help maintain your kidney health and slow the progression of chronic kidney disease complications. 1. Vitamin D. The kidneys are responsible for converting vitamin D into active metabolites and are essential for absorbing calcium and phosphorus. Those suffering from chronic kidney disease may have low vitamin D levels primarily because damaged kidneys have difficulty converting vitamin D into its active form. Taking a vitamin D supplement may suppress the progression of chronic kidney disease and help you reach a healthy vitamin D level. 2. Iron. Anemia and chronic kidney disease often occur together. People with chronic kidney disease are more likely to have lower hemoglobin levels, the red pigment in healthy red blood cells. Hemoglobin carries oxygen throughout the body. Having anemia may lead to fatigue and lack of energy, making it challenging to maintain a healthy lifestyle. If your kidneys are not functioning correctly, they cannot help your body make the red blood cells it needs. Taking an iron supplement may help restore your red blood cell count and may prevent you from developing anemia. 3. Vitamin B9. Vitamin B9, also known as folic acid, helps your body make healthy red blood cells. If your body is low in vitamin B9, your body may produce abnormally shaped red blood cells, leading to anemia. In addition, vitamin B9 or niacin may help slow down rising phosphorus levels in people with kidney disease who are on dialysis. Phosphorus is harsh on the kidneys and may cause further damage to already injured kidneys. In addition, excess phosphorus in the kidneys can cause kidney stones and other kidney problems because phosphorus may cause more calcium to go into the kidneys. 4. Vitamin B12. Like vitamins B9 and niacin, vitamin B12 may help protect against problems with red blood cells. Vitamin B12 may also help regulate the amount of phosphorus in the body. While vitamins are not a substitute for dialysis or kidney surgery, they may help support your kidneys and maintain your health. So whether you have chronic kidney disease or want to maintain healthy kidneys, vitamins may help return your body to a healthy equilibrium. Remember, before taking any new vitamins or supplements, it is best to talk to your doctor to determine which vitamins are best suited for your specific condition. Vitamins to avoid. While vitamins tend to be inherently safe, some vitamins may cause problems if taken in large doses. High doses of vitamins may lead to kidney damage and chronic kidney disease, as well as other health issues. For example, if you have renal issues, foods containing vitamin C may cause kidney stones. Do not take vitamins containing phosphorus, as this may lead to complications with your current kidney function and may even damage your kidneys. Vitamins that contain potassium, such as some vitamins for fatigue and pre-workout products, may also be harmful to those with kidney disease. In addition, potassium is harmful when taken in high doses, especially for those with kidney failure, because your body cannot process potassium like those with healthy kidneys. When choosing a supplement that is right for you, it is best to consult your doctor first. Water-soluble vitamins such as B vitamins are better for those with kidney disease because they are excreted by the body and generally do not cause harm to the kidneys. Contact the Kidney and Hypertension Center. While vitamins may be beneficial to the body, vitamins should not be a replacement for medical treatment. If you are experiencing any symptoms of kidney disease or are struggling with hypertension, the experts at the Kidney and Hypertension Center may be able to help. Call 1-833-24 Renal or request an appointment and be on your way to better health today. So bless, subscribe, like and shared. Until next time, goodbye.